much for the invitation to speak this evening. I just want to apologize that my audio or my video is not on. I just walked in the door at a late emergency and my camera is acting a little bit wonky, so I apologize, but you're not missing anything. I'm wearing scrubs. I just got back from the office. Anyway, today we're going to be talking a little bit about cataract surgery in 2024. It's a big topic. When I was in residency, talking with patients about cataract surgery was a much more simple, much easier discussion. But over the past 20 years, the technology, the type of lenses we use, the way we do the surgery has evolved so much that it's become a lot more complex and there's a lot more to it. So I'm going to try to give an overview of what cataracts are, what cataract surgery involves, a little bit about the lens implants that we use at the time of surgery, and then I have to take some time for questions. I've also embedded a couple of videos, which hopefully will work and may be interesting to watch. So what is a cataract? A cataract is simply just a clouding in the lens in the eye. The lens is a structure sort of in the middle of our eye, right behind our iris, that helps us focus light on the retina. So if you're looking through this cross section of the eye, the front of the eye, the cornea is on the left side, and the back of the eye, the retina, and then the optic nerve is on the right side. So light passes through the cornea, where it's sort of bent, and it's bent a significant amount more by the lens, and then it focuses on the retina. A cataract is just clouding of that structure in the middle of the eye. When we're born, it's a clear crystalline structure. And as we get older, starting in our 60s, it starts to become cloudy. Usually, cataracts are age-related, but sometimes they can be due to diabetes, due to trauma. Certain medications, especially steroid medications, can cause cataracts to form. And rarely, there are congenital cataracts that we're born with. Typically, they don't develop age-related cataracts until we're in our 60s, but most people don't require surgery until later in their 70s or 80s, although plenty of people need surgery significantly earlier. And cataract surgery is indicated when it's having an impact on your activities of daily living. So it's not really so much that the cataract, is like this dense or this bad. It's more just related to how much difficulty a patient is having doing things they like to do or need to do. Symptoms of cataract include blurry vision, glare and halos, difficulty with night vision and night driving. And in my experience, that's the most common indication that I find for doing cataract surgery. My patients are bothered by glare and halos around car headlights and hard difficulty seeing road signs and the lines on the road, needing a lot more light to read, and colors just looking dull and faded. So here's some pictures of a cataract. So on the left side, that's a dilated pupil. We're looking directly at somebody's eye. And when you look at a normal lens, it's pretty clear and you should be able to pretty much see through it. But you can see that yellow-orange structure. That's a pretty dense cataract. In fact, that's something that we don't see every day. That's something called the Morgagnian cataract, where the cataract is actually sort of melting, if you will, liquefying. You can kind of see there's a denser yellow area surrounded by some white area sort of floating there. That's pretty uncommon, but I like that picture a lot because you can get the sense of just how cloudy it would be to look through that kind of a cataract. On the bottom right, there's something we call a white cataract, which we sometimes see in younger patients that have cataracts. And also you can imagine you can't really see through that. And there's a schematic above that showing a normal lens, which is clear versus just sort of a haze from the cataract on the right side. So the only way to really fix cataracts at this point in time is cataract surgery. There aren't any eye drops or pills or medications that will fix them. There's been a lot of work going into those, and nothing has really come to fruition. It would be great if they cure them, preferably at some point after my career ends, because I enjoy doing cataract surgery. But the main indication, as I mentioned, for doing cataract surgery is when they're impacting somebody's activities of daily living. There are some rarer cases where cataract surgery needs to be done for other reasons. There are certain forms of glaucoma that necessitate removing a cataract from the eye. If the cataract is so dense we can't see the back of your eye, if a patient feels that they're not having trouble but they can't pass their driving test, and a couple of other medical reasons that are a little less common. If both eyes require cataract surgery, they're typically done between 1 and 4 weeks apart. I usually do them 2 weeks apart. And just because one eye requires surgery doesn't mean the other one has to be done, although often they are done together. With the cataract surgery, the cataract is removed and a new artificial lens is placed. They're often made out of acrylic. There are some other materials that are used. Cataract surgery is common and safe, though there are risks. So there's a small risk of loss of vision, infection, bleeding, need for more surgery, delayed healing, Those are the main risks of the surgery. It's a same-day outpatient surgery. It is not a laser surgery, which is a common misconception, but it can be laser assisted. And I have a couple of videos that should go into that as well. When cataract surgery is performed, we usually use light IV sedation. It's not really twilight anesthesia or what you might get for a colonoscopy where you're pretty using propofol. But usually the anesthesiologists we work with give a little bit of a medicine called midazolam or something called Versed to just get you a little bit sleepy so you can still understand what we're saying if we need to speak with you, or if you're uncomfortable to let us know. Usually it's really not very uncomfortable. The problem is if you're too deeply sedated, we're not using general anesthesia, you can kind of fall asleep and then wake up. And you can imagine cataract surgery, which is a very precise microscopic operation, if you move your head around a little bit, that can have some devastating consequences. So it's actually better to either have you really lightly sedated or just completely asleep. And so we opt to do it with light sedation most of the time. Surgery itself takes me about 10 to 15 minutes, sometimes a little longer with more complicated cataracts. It's highly successful, low risk of the complications that I mentioned. The vision is usually good within a couple days, although it's not fully healed for about a month, but usually within a couple days, the vision is good. Sometimes the vision is 20/20 the day after surgery. Sometimes the vision is terrible the first day after surgery. So it's not like LASIK surgery where it's universally good immediately after the surgery unless there's some problem. Cataract surgery is variable, and I always tell people it might be good, it might be bad. One eye might be good the next day. The other eye might not be good the next day. But typically it's going to clear up usually within a matter of days after the surgery. The steps of the surgery, and I'm going to show you some videos and you'll kind of see these steps. So if we're using laser-assisted cataract surgery, we basically do the laser portion of the surgery, which we'll get into in a minute. We make 2 incisions in the eye. They're really small. The smaller one is about 1 millimeter. The larger one is just over 2 millimeters. They're small enough that we're able to hydrate those incisions to get them to close without using a suture. The next step is making an opening into a structure called the lens capsule. So your lens is surrounded by a clear structure called the lens capsule. It's thinner than a human hair. We make a round opening into that capsule in which we access the lens to remove it, and we break it apart using a special ultrasound called phacoemulsification. And then we place a new lens implant in the same capsular bag where your natural lens was before we removed it. So this is sort of a cross section of the eye where you can kind of see a picture of the cataract and the structures in the eye here. This is supposed to be a video, but unfortunately the video link is not working. I embedded a video link in this, but it doesn't seem to want to go. Let me see if there's some other way. I apologize. Give me 1 second. I'm gonna try to see if I can show this video because I think it would be really helpful to play this. Let me see if here we go. Let's see if this works. Okay.
Hi.
Oh, if I think if I leave it minimized, maybe it'll work. Oh, let's try this once more. Sorry about this. This is a video that's from an academic center that shows a really nice walkthrough of cataract surgery.
Hi, I'm Surendra Basti.
Oh, sorry about that. Oh, I'm going to try once more. Okay.
Hi, I'm Surendra Basti. I'm the director of the Cataract Service at the Department of Ophthalmology, Northwestern Medicine. Today, we're going to perform femtosecond laser-assisted cataract surgery. And Northwestern Medicine was among the first academic departments in the nation to adopt this exciting technology. So today, join me for this edition of Inside OR. Today's procedure is expected to take us less than an hour. The first part is done with the femtosecond laser, where the patient is very much awake, but the eye is fully anesthetized.
So I should just chime in for a second and warn anybody who's squeamish and may not want to watch an eye surgery. This would be probably a good time to turn off your video, but I'll play the video now, sir.
The second part of surgery is done in the operating room, and that's expected to take about 30 minutes. So the laser takes an image of the eye and then takes a cross-section of the eye, and the measurements permitted to program the laser so that it can accurately do the surgical steps. The laser just opened the cataract.
Sorry about that. Sorry, hold on 1 second. Sorry about that. Oh. I'll try to go back to where we were.
Hi.
Sorry.
Today's procedure is, and that's expected to take about 30 minutes. So the laser takes an image of the eye and then takes a cross-section of the eye, and the measurements permitted to program the laser so that it can accurately do the surgical steps. The laser just opened the cataract, and it's now dividing the cataract into 6 pieces. And in just a moment, it will create the incision in the eye. So the laser part's done. What we're going to do is mark the eye before we go to the next room. Your eye is anesthetized, so you're not going to feel this. I'm just coming next to the eye to make what we call reference marks. So the rest of the surgery we'll do in the operating room, and we're ready to head there now. So inside the eye, all of us have a structure called the lens. And when the lens begins to get cloudy, that's what we call cataract. So cataracts commonly occur in people in their 70s and 80s. However, genetics, UV light, cigarette smoke, steroid medications, these are risk factors for cataract formation. So the laser opened the cataract in a very circular manner. And I'm just moving the cataract around, and that makes cataract removal a lot easier for us. So we have these ridges created by the laser here. Those ridges permit us to very easily divide the cataract into 6 pieces. And so gentle suction and small amounts of ultrasound, we will suck out the cataract that's been broken by the laser. The cataract's been completely removed. And what you can see here is a round opening, which makes my placement of the lens very precise. So the Callisto device is prompting us to place the lens in the direction of the blue line. I'm just going to make what we call as a reference mark that I can use when I actually place the lens. The lens is made of a material called acrylic, and acrylic has been observed in the human eye for over 70 years now. So it's going to stay in the human eye for a human lifetime. Some of us look at it as a legacy that we literally leave behind from what we do for the patient to enjoy for the rest of their life. The cataract has an outermost covering called the capsule, and the artificial lens is actually going back inside the capsule. So essentially, the lens is going in the same location where the cataract was. We're using this intraoperative guidance system here to perfectly align the lens at the 3 dots, indicating where the astigmatic correction is nicely aligning and overlapping with the blue line created by the Callisto device. We're now going to check all the incisions, make sure the eye is like we want it to be, with the tissues looking physiologic and also the incisions looking very strong. After the surgical procedure, the eye feels a little scratchy and teary, perhaps for a couple of days. The patients are able to begin to see improvement in vision within a day. and details of objects and high quality vision is restored in the first 1 to 3 weeks after the surgical procedure. So we expect the patient to make a good recovery. She was nearsighted her whole adult life, and I expect starting tomorrow that will change permanently. She'll have a very broad range of vision even without eyeglasses, and hopefully that will serve her well for the rest of her life. Thank you for joining me for.
Okay, so I hope that worked. So, but I thought that was a really nice video of basically just the process through cataract surgery. There's one little difference that you may have noticed for that surgery. Sorry, let me skip ahead here. Okay, where he talked about, the surgeon talked about using something called femtosecond laser-assisted cataract surgery, and that was the device at the beginning of the case that was done in a different room from the operating room. So femtosecond laser-assisted cataract surgery, or FLACS, is a technology that's been around now for about 15 years, and it's slightly longer, maybe 16 or 17 now. But it's basically a laser that does not do the surgery, but it helps with the cataract surgery. So it assists with certain steps. So prior to going to the operating room, a laser treatment is done. It's not a sterile procedure like the cataract surgery. And the laser makes the incisions. It makes the opening into that capsule, or what's called the capsulorhexis, to allow us to access the lens. It softens the lens nucleus and makes it easier to chop or break apart. It can also treat low levels of astigmatism up to about, they say up to about 1.5 diopters, probably up to about 1 diopter is more accurate. The benefits of laser-assisted cataract surgery over standard cataract surgery is it's a little more precise because you can make a really nice circular opening into the lens capsule, which helps center the lens nicely. And it also allows you to use a little bit less ultrasound energy in some cases, which may allow for faster healing of the cornea. And it's pretty fun as a surgeon. It's, you get to use a laser. It's pretty cool. The cons of it is it's not covered by insurance. So cataract surgery, when it's medically indicated, is covered by insurance, versus if you do laser-assisted surgery, that portion of the surgery is never covered by Medicare or insurance. So it's an out-of-pocket cost to the patient. And it's not clearly superior to standard surgery. So there's been studies looking at this, and we do believe there are certain patients that benefit from it. Certain cases when we're doing multifocal or astigmatism correcting lenses that we'll talk about later, there may be a benefit. And the other benefit that I didn't mention here is that it can be used to treat astigmatism. When you maybe have not quite enough astigmatism to put in a special lens to correct it, for example. And like any other procedure, there are risks of rare complications from the laser itself. So that's sort of the overview of this. So this is another video that I'm not gonna show of laser assisted surgery, but I'm just gonna show this graphic, which just shows sort of the pattern that's applied to the lens, one of many that you can choose from when you're doing laser assisted cataract surgery. And that little waffle pattern, that graph, it sort of segments the lens a bit so we can use less ultrasonic energy when we're removing the cataract. But at the end of the day, you still have to go in and remove the cataract using the ultrasound. So it doesn't replace the surgery. It sort of is just another added step in the surgery that has some benefits. And people like the idea of laser cataract surgery. Patients ask sometimes for bladeless surgery. And so people like the idea of not having an incision made with a blade. Whereas, in reality, it's really not super different. It's just a different tool making the incision. You still have to make the same 2 incisions, as you can see in this picture here. So this is the video. That was the video for the Catalyst laser. I guess let's take a quick look at it for the laser assisted.
When light passes through a clear lens, the light can focus to a point, creating a clear view. Over time, the lens becomes cloudy or opaque and develops into a cataract. When light passes through a cataract, the light gets distorted, creating a blurred view. Compared to vision with a clear lens, your vision with a cataract may look fuzzy and colors might be muted. These visual disturbances from cataracts are progressive, and when they become bothersome or limit your daily activities, it's time to consider treatment. Treatment for cataracts involves removing the cataract and replacing it with an intraocular lens implant that can help restore clear vision. Many of the steps of cataract surgery that are traditionally performed using handheld tools can now be completed with a laser. Using the Catalyst Precision Laser System, your surgeon can provide you a customized, laser-precise, and gentle approach to your cataract surgery. How does the Catalyst Laser System work? Every eye has a unique size and shape. Prior to treatment, the Catalyst system scans the eye, making a precise 3D map of relevant structures. This process enables your surgeon to create a customized treatment plan that is uniquely tailored to your eye. How does laser cataract surgery with a Catalyst system compare to traditional manual surgery? In traditional cataract surgery, your surgeon uses handheld blades to create incisions in the cornea for accessing the cataract. Your surgeon will then use a surgical instrument to manually create an opening in the lens capsule that holds the cataract. With the Catalyst system, your surgeon can use the laser to make the corneal incisions with excellent precision. Moreover, your surgeon can use the laser to create the circular opening in the lens capsule with precise size, shape, and location. The goal in these steps is to make the corneal incisions precise and the opening in the lens capsule as circular as possible, in the right location and size to fit the replacement lens. With the Catalyst system, your surgeon can also soften the hard cataract and segment it into manageable pieces. Shown here is a Catalyst laser grid pattern softening the cataract. Your surgeon may recommend using the Catalyst system to create additional laser-precise incisions in the cornea. The next step in both the traditional and Catalyst laser system procedures is to remove the tissue and then break up and remove the cataract. In the traditional approach, your surgeon will insert mechanical instruments into the eye and use ultrasound energy to break up the hard cataract into pieces that are small enough to be removed. In laser cataract surgery, the softening of the lens by the Catalyst system enables your surgeon to remove the cataract in a gentle manner. For both traditional and Catalyst laser system procedures, the precision of these steps sets the stage for accurate positioning of the replacement lens. And accurate positioning of the replacement lens is one of the critical factors for achieving the desired visual outcome. Your surgeon may recommend a treatment plan that could include a specific lens implant type and additional incisions in the cornea. In traditional cataract surgery, these corneal incisions are made with a handheld blade. With the Catalyst system, your surgeon can customize these incisions for you with laser precision. These laser incisions are highlighted in blue here. What are the benefits of laser cataract surgery? With the Catalyst laser system, your surgeon can provide you with a customized treatment with advanced 3D imaging, a laser-precise treatment, and a gentle approach to surgery. To find out more about laser cataract surgery, ask your doctor if the Catalyst Precision Laser System is right for you. The Catalyst Precision
Okay, so anyway, there's a pretty good overview of laser-assisted cataract surgery. There's a couple of things I take issue with it. So they mentioned that it creates a customized approach. Cataract surgery is always customized because we're spending time to take precise measurements of your eye and choosing which lens and which technique. So that is not unique to laser-assisted surgery. They also and they tried to make the opening into the lens capsule look a little bit rattier than it actually is. When I think we do a pretty nice job making a nice circular opening without the laser. But for sure, the laser does make a really perfectly round opening into the lens capsule, which does help center the lens there. I also do agree there is a point that they made about using laser to make incisions in the cornea to diminish astigmatism. It is more accurate in my experience doing it with a laser than it is by hand. Anyway, the next thing I wanted to talk about with cataract surgery is something that's really, really important and critical when you're having cataract surgery, which is the lens implant and what type of lens implant to go with. This discussion just every year gets more and more complicated as the number of choices for lens implants seems to ever expand. So I'm going to talk about sort of some broad categories of lens implants. So if we were to not put a lens implant in somebody's eye at the time of cataract surgery, then typically you would need a Coke bottle glass, like maybe a +15 to +20 power, and that's in fact what was done in the past, or a hard contact lens. So we always put a lens implant in your eye, and there are lots of different options of what we can do with those lens implants. So a standard lens implant, or a conventional lens implant, as some people call them, is a monofocal lens implant, meaning it has one focal point, and we can choose it to be a focal point for close-up vision, so you can see near but not far away, much like if somebody is nearsighted. We can correct your vision for distance but not reading, which is like somebody who has normal distance vision but requires reading glasses, as most people do after our mid to late 40s. Or we can do something called monovision, which is a mixture. We take the dominant eye typically and correct it for far away, and leave the non-dominant eye a little undercorrected for reading. So that eye doesn't have as good distance vision, but as good reading vision. That's a good option for some people, especially for people who have done that with a contact lens and are used to it. Not everybody loves that, and so it's the kind of thing you definitely want to try it out, at least with a contact lens, if it's possible, before jumping into doing monovision. The next type of lens implant is something called a toric lens implant. A toric just means astigmatism correcting. And astigmatism just means your eye is shaped more like a football than a basketball. So it's a normal thing. There are abnormal types of astigmatism, but this is fixing what's called normal astigmatism, or just astigmatism that's regular, meaning that it's steep in one area of the cornea and flatter in another. There are what are called presbyopic lens implants, and there's several different types. The two main categories of presbyopic lens implants are multifocal lenses and what are called extended depth of focus lens implants, and I'll talk about those in a minute. Presbyopic just means correcting your near vision as well as your distance vision. Then finally, there's another type of lens that's a very specific lens implant called the light adjustable lens, or LAL. And I'm also going to show you a little bit about that. So these are sort of the broad categories of lens implants that can be used at the time of surgery. Not everybody is a candidate for every one of these lenses, so it really depends on a lot of factors specific to an individual's eyes. So a standard intraocular lens implant, or IOL, or the conventional lens implant, are covered by insurance entirely, or Medicare. We can, like I mentioned, target near, distance, or both, one eye for near, one eye for distance. The benefit of these lens implants, in addition to the fact that they're covered entirely by insurance, is that they do not compromise your quality of vision, because it is a clear lens. So this lens, the entire lens is clear. I use a very high quality monofocal lens implant. There's several of them out there. I happen to typically use one called the Tecnis Eyhance lens. And so it's a crystal clear lens. It doesn't have any aberrations on the lens or anything that would distort your vision, which some of the other choices can. It does not correct astigmatism, and it doesn't fix near and distance. It fixes either distance, near, intermediate, whatever you target, but it doesn't fix more than that, because it focuses the light on a single point. This is a picture of the lens that I typically use for my monofocal, the Tecnis Eyhance IOL. The central part is what's called the lens optic, and that's what you see through. Those arms hanging off are what are called the lens haptic, and those are what hold the lens in place, and the capsular bag that we leave intact fibroses around those haptics to keep the lens in the center of the eye. So a toric intraocular lens implant is the lens that I mentioned that corrects astigmatism for when your cornea is not spherical. Toric lens implants are available for most lens types. So you can get a standard toric lens, meaning a monofocal. For example, that Eyhance lens that I showed you comes in a toric lens, or in any of the special multifocal trifocal lenses, or the extended depth of focus lenses also come in toric lenses. And The bottom line is that toric lenses are not covered by insurance. So insurance or Medicare consider this not necessary because they say, well, you can just wear glasses after. They consider anything other than the standard lens to be, in a way, cosmetic because it's something that you're correcting with a lens implant that you could just get glasses to correct afterwards. This is a picture of a toric lens. So the difference, it's subtle in the picture between a toric lens and a standard lens when you look at it, is that it has these three little dots at the junction between the optic and the haptic that you can see on each side. And those little dots basically mark the steep axis of that lens. So if you remember, I mentioned that these have a steep and a flat axis that are 90 degrees away from each other to correct astigmatism. And so you have to figure out where a patient's astigmatism is, mark the eye for that, which you saw in the first surgical video, and then line up those hash marks there with the patient's astigmatism. And that's how we know that it's lined up correctly. We sort of just mark the eye where the astigmatism is, and there's a whole bunch of ways of doing that, and line up the lens, the steep axis of the lens. The next category that you probably have heard something about, there's a lot of talk about, are multifocal intraocular lens implants. These were developed, the early ones, when I was starting my residency in the early 2000s. And the first ones were really rudimentary and not great. And there have been a whole host of these over the years that have come and gone. But there's different flavors of multifocal lenses. So there's something called a trifocal multifocal lens implant. And that is a lens that corrects three different zones of vision. So it corrects your distance vision, close-up reading, which is about 16 inches or so, and intermediate vision, computer range, about 22 inches away or thereabouts. So it gives you three different focal points for vision: near, distance, and intermediate, much like you get with a progressive bifocal, although it works in a completely different manner than a progressive bifocal. It's not like a progressive where you have to look down to see close up, and sort of in the middle gives you an intermediate range. Your entire lens gives you all that range of vision because of these little rings on the lens, and I'll show you a picture of that in a minute, that split the light essentially for near, distance, and intermediate. The benefit of these lenses is that it reduces the need for glasses. There's no guarantee that with any of these lenses, you're not going to need glasses. There's a whole host of reasons why. It's not an exact science. With the precision of these of our measurements and your eye, it's pretty good, but there are things that are out of our control, such as something called the effective lens position, that can leave the eye a little nearsighted, a little farsighted. And also, even if you're get right on target for 20/20 distance, not everybody is completely independent of glasses for reading or intermediate with these. So we say they will typically significantly reduce your need for glasses and maybe eliminate it, versus a conventional lens implant. Now, the downside of these lenses, because they have these rings which split the light for near and distance, and I'll show you a picture of this shortly, they can create some halo or glare effect. Some people don't find that bothersome at all. A lot of patients notice it, but find that it gets better with time and it isn't that bad. However, some people find that really bothersome, and there are cases that are not unheard of where people actually want to have these lenses explanted or removed to replace with a clear lens. Now, that is definitely the minority of cases. Most people are thrilled with these lenses. Even if they have a little glare, it usually gets better as their brain adapts to it. But there are cases where people find the glare and halos to be fairly bothersome, and that's a real drawback to these lenses. They're not covered by insurance, and they're fairly expensive. And again, with any lens, you still may need glasses, even with the multifocal lens. It's not a guarantee. So this is a picture of the PanOptix lens, which is the multifocal lens that I use as a trifocal lens. And you can see it has these little rings on it. And you can imagine this is an actual photograph, surgical photograph at the bottom there, with somebody who's had that lens implanted. And so you are looking through those rings. And so you're not going to see like rings in the vision, but you can get a distortion or halo from them. And it's mostly around lights. And again, it usually does get better with time, but sometimes it doesn't. And those rings are necessary to allow you to see near, intermediate, and distance. They sort of split the light. Another category of lenses that we use sometimes is something called an EDOF, or extended depth of focus lens. So an extended depth of focus lens, unlike a multifocal lens implant with like the PanOptix, which I just showed, the extended depth of focus lens, rather than providing multiple focal points, provides a single continuous elongated focal point. So instead of having like near, intermediate, distance, it kind of gives this blended intermediate and distance. So it's an elongated point of focus. And these are generally quite good for faraway vision, and they're good for computer range vision. They are not great for near vision. Most people I put these lenses in will still need a small reading glass for reading a book close up, but most people that we use these lenses and are able to see the computer screen or their phone, at a comfortable distance and far away without glasses. The drawback is that the pros of this lens versus a Panoptix is that there is significantly less risk of glare or halos in a multifocal because they don't have rings on them. And again, they provide good intermediate and distance vision. The cons is the cost. Again, they're priced similarly to a multifocal lens. You're still probably going to need reading glasses close up. And there still is a bit of a diminished contrast versus a standard lens. A monofocal implant still gives the best contrast and probably still gives the best quality of vision because there is a little bit of a central irregularity in the lens that allows that elongated focal point. And this is a picture of that. So there's not a ring. It's hard to see in this photo. It sort of looks like there's a ring on this lens. There really isn't. It's a very subtle, elevated, almost like a little button in the center of the lens. It's actually hard to see it. You have to kind of look for it. Unlike the Panoptix lens, which is when you look at these lenses, you can see those rings staring right at you. This is actually subtle. You kind of have to look for it. When you see one of these in somebody's eye, in the exam room, it's sometimes hard to tell that it has anything other than a regular lens. You have to look for that little central raised area. This is an optics slide. I hope not to get too much into the weeds of physics and optics, but this is showing these three different types of lenses. So a monofocal lens, the circle represents the lens, which bends the light. So the light focuses together where that single arrow is in a single point. And that's a normal monofocal or a standard monofocal lens. The second is a multifocal lens, like the Panoptix. This is not really like the Panoptix. This is like like an older generation multifocal. And we still use those, by the way, too, in some cases. Where it creates two different focal points. The Panoptix actually creates three focal points, near, intermediate, and distance. And finally, the last one is the extended depth of focus, where you can see it doesn't have discrete focal points, but it has a zone. It sort of has this extended zone of intermediate and distance vision. The last type of lens I want to talk to you about is a lens that started being developed at the end of my residency, and I was absolutely fascinated by this and watched the development of this until it finally came to market not too long ago. Something called the LAL, or light adjustable lens. So light adjustable lens is an intraocular lens implant that can be adjusted after surgery to perfect the lens power. So it's pretty wild, but you put the lens implant in the patient's eye, and then afterwards in the office, you use a special ultraviolet light, which changes the shape of the lens so we can adjust the power of that lens. So if you end up a little nearsighted or a little farsighted, we know 20% of the time with cataract surgery, we're more than 0.5 diopters off from being the targeted refraction, and we can correct that. We can also try a little bit of monovision. If you're interested in undercorrecting one eye to make it for intermediate or near, you can do that with this. In fact, that's what a lot of people are doing. And then if you don't love it, you can actually go and undo that by using a light adjustable lens treatment up into a certain point. At some point, you have to do a final lock-in treatment to lock this in, and at that point, you can no longer do any further adjustments. The pros of this, from my standpoint, I believe it's the most precise option because we know that there's a percentage of people that were not exactly right on target from cataract surgery, and there's no way around that. It has to do with things that are really out of the surgeon's control. No matter how good your measurements are, how good the lenses are used, there's a percentage of time that we're going to end up a little bit nearsighted, a little farsighted, and you can correct that. You can tweak. You can also correct astigmatism. This is technically indicated as a toric or an astigmatism correcting lens. Because it treats up to, I believe, 2.5 diopters of astigmatism, but rather than having that baked into the lens, you do that astigmatism correction using the light delivery device in your office after the surgery, which makes it really precise. So instead of manually lining it up and marking the eye and hoping that you're right on target, which we usually are pretty close, it's really precise because it's done in the office using you basically plug in the prescription and it puts in a treatment pattern to do that. The downside of this lens is that there's an extra cost to it. It's more expensive than the other lens implants that I mentioned. It's quite a few extra post-op dilations. Your eye has to be dilated at a number of post-op visits. to do the light delivery adjustments. And you have to wear UV blocking glasses when you're outside for a month because it is affected by ultraviolet light. So when you're outside in natural sunlight, you have to wear special UV blocking glasses for about a month. But the benefit, again, is unparalleled precision. This is a picture of the light adjustable lens and kind of how it works. So the delivery device, the LDD, the light delivery device, is an office machine and that directs light to the lens, and it has these photopolymers and macromers in the lens that are moved around basically by that ultraviolet light while it's in your eye. And so you expose a specific treatment pattern, and it actually changes the shape of the lens. So that's how it works. You can reshape the lens using a special ultraviolet light in the office. It's pretty cool technology. So that's really all I have. I know it's a lot to digest and a lot of complicated information in a pretty short time, but the bottom line is that in cataract surgery in 2024, there's a lot of choices as far as what type of lens to use, whether to do laser-assisted cataract surgery. But the bottom line is there's people ask me all the time, my patients say, I just want the best lens. I just want the best surgery. There is no one size fits all. Just like there's no one time to do cataract surgery. I have some patients that have mild cataracts that drive them absolutely crazy and they can't drive at night, and we get rid of the cataract and they're extremely relieved and can do everything they need to do again. And I have patients that have horrible cataracts and I look at the eye and say, how can you see through that rock? And they're doing okay. So it's extremely variable how people experience cataracts, and there's no one size fits all surgery for cataracts. All of these lenses are excellent choices. There's no one lens that's better than the other. They're all excellent, or else I wouldn't put them in anybody's eyes. So a standard lens is just as good as a multifocal lens. It's just as good as a toric lens. It just depends on what's right for you. And none of the lenses available, unfortunately, will guarantee that you're going to be completely free from glasses or contact lenses. It's not a, we're really close, but it's not an exact science, and we're not 100% there yet. But that's the kind of the most important takeaway is there are a lot of choices, but there really isn't one best option. There are some people that get a multifocal lens and love it and are thrilled, and that's the way to go. They need to see near, distance, intermediate. They don't have to worry about night driving. So they're not really concerned about the risk of glare. And then there's other patients say, I want the greatest quality vision. I don't care if I have to wear reading glasses, in which case they're better off with a standard lens because that's still going to give you the best quality vision because it doesn't have those rings on it. So there really is no one right lens. There's a million choices, and they're all good for the right patients. So thank you everybody for listening. I hope that was helpful, and I'd be happy to answer some questions.
Thank you so much, Dr.